Welcome to 304 Today. I'm your host, Lauren Winans. We've got a lot of great health information to share with you today, but there's no better place to start than with our friends from Enliven Wellness. I am here with Dr. Matt Mason, and we're going to talk about Webster, which is pregnancy, chiropractic, pregnancy, and doing chiropractic on children, correct?
Yes, absolutely.
So I had Webster technique done, and both of my kids literally lived at the chiropractor as infants and children. So tell me and the viewers at home, what is the Webster technique?
So basically the Webster technique is a technique that is, the primary focus is to basically flip breech babies. If
and
the baby,
works.
yes, yes,
It works.
very, very well, and it's a relatively gentle procedure that is actually much safer than the typical approach to turning a breech baby, and is also extremely effective at accomplishing that to reach that goal, I guess I should say.
So I had Webster technique done many times in pregnancy. I am not currently pregnant, but he's going to work on me as if I were a pregnant woman with a breech baby. But you don't have to have a breech baby to have chiropractic done during pregnancy, so just remember that.
Yes, absolutely. So basically the approach to start the procedure essentially is I would have you laying on your stomach. So obviously if you're pregnant, then we have a special pillow to kind of cushion a little bit, or we can actually unlock the table to let the stomach drop down in the middle there.
But right here.
Yep, so you're just going to lay face down there, and then there's armrests down at the side actually for you.
I see. Okay.
Yeah, it'd make it a little bit more comfortable. But basically, I'd go through a quick check, just checking primarily the pelvis and the sacrum, because our main goal is to keep that all moving properly to provide the most space for the baby, basically, to allow them to flip back head down, essentially. So babies are top heavy, more or less, so if you give them that space, they can turn on their own, more or less, is kind of the goal for it. But yeah, so essentially what I'd be doing is I'd be checking the tension of your sacrum and pelvic ligaments, and we do that basically just by bending your knees up. And I'd just be checking to see if there's tension on one side or another. Typically, in the case of a breech baby, that you'd have a locked up pelvis on one side, essentially. And
I probably still have a locked up.
I will say it's not too bad right now, actually. But basically what we'd see is one leg would be able to go down a lot farther, and one would be more restricted here and be tight almost. So that'd be an indicator that we need to work on that side to help loosen that up. So basically we do that through two different ways. One, I'd actually do an adjustment for your sacrum, or your tailbone, essentially. So the area we'd be working on is basically right down in the middle, where a lot of people call kind of the small of the back, and you work kind of right down below that. So I'd be checking to see how that's moving side to side, basically pushing side to side here. And yours is actually a little bit restricted, moving right to left, so that's kind of the way I would adjust it from that point.
Okay.
So to do that, we would use either basically light force instruments or what's called a drop table. So the drop table, actually you're a little bit high on this table here to do that. So to do that, I would actually have you scoot down a good bit here towards your feet. So yep, just like that would be perfect. And when we use the drop table, it's actually just a piece that pops up just like this, and it just drops away just about an inch or so. Of course, this one's really cranked up, so we're going to turn that down for you. And it'll just drop away like that, essentially. So it's just moving about a half an inch or an inch or so. It sounds really loud when we do the adjustment, but it kind of makes a loud bang, essentially, but is...
But I'm not feeling the bang.
Yes, exactly, exactly, but it's actually really gentle, so...
I promise I'm not hurt.
Yes, exactly. So the other way that we can potentially adjust that, depending on your tenderness levels, would be with what's called an arthrostim. So arthrostim is basically like a mini jackhammer, essentially, that we can be basically really gentle with it or really strong with it to kind of shift that back into place. But most of the time it doesn't take much force at all, and we always go by the tolerance of the patient. We always say goal is not to torture you. It's definitely to get you better in the gentlest way possible.
Well, I think that's a good time to say, people think chiropractic is all cracking and maneuvering and pain, but it's very gentle.
It really is, yeah. There's not a whole lot of twisting or anything like that. It's not what a lot of people see on social media,
Right.
at least in over 90% of offices you go into. It's actually much gentler than you think, that's for sure.
Well, that's going to lead us into children in chiropractic, because
Yes.
I believe you're going to show how you adjust a child.
Yes, absolutely. So,
All right, let's go find a kid then.
okay, we can do that.
So Dr. Matt is going to show us how to adjust a child right now.
Yeah.
And what are you going to be doing to him? What is this benefit?
So basically the benefit is we're going to be checking his joints, both in his pelvis and in his spine, and seeing how each joint is moving essentially. So basically we're looking for any joint that's not moving as well as it should be, or not having the proper range of motion, and we're going to restore that actually. The way we're going to be doing it is actually much gentler than what a lot of people, I think, perceive in their mind that we do with kids. Instead of, I'm not going to be twisting his neck or jumping on him or anything like that, or anything close to that. We're actually just going to be using something extremely gentle, where it's just basically called an activator, essentially. So it's basically just a little tap. You can even do it to your index finger. It hardly does anything. We can adjust the strength of it depending on where in the spine we're using it, but it's never very high for kids because you don't need to use much force at all. Definitely don't need to use anything like what we do with an adult, which still isn't as much as a lot of people think.
All right, well, let's watch you do this then.
Okay. Xander, you ready? We're going to get you fixed up here, okay, bud? So we're just checking Xander's spine here to see how everything's moving. And there's one spot actually right here in his lower mid-back that's just a little bit stiff. Is that a little tender, Xander? Or does that feel okay? Feel okay? Good, good. So we're just going to get that moving better for you again. So we're just going to use a little activator that Xander's a pro at this. He's had this before several times, but it's just going to be one little tap here. And that's about it. Pretty easy, right, Xander? Yeah. Feel good? Good. Okay. He's a little shy today. That's okay. But
And now for my children, they both had colic, and they both had, like, my daughter was lip, tongue, and cheek tied. So chiropractic was very helpful
absolutely.
for both of my kids. Can you explain how chiropractic in infants can help nursing, and it can help with colic and reflux?
Absolutely. So in infants, obviously much younger than Xander here, but it can be extremely helpful for, yes, colicky babies. It can help with latching, actually, if they're having any issues in their mid-back or neck, actually. Childbirth can be very traumatic at times, especially more natural childbirths, obviously. That's a traumatic passage there, but we can get that moving pretty easily for them, and children respond extremely fast, much faster than adults do, actually. So it's always a lot of fun treating them because you can almost see instant results sometimes. So it's always something we really enjoy doing, and try to help whenever we can in those situations.
Do you feel better?
Feel good there? Very good, Xander. Is your neck been bothering you at all? No? Good. Very good. We'll just check that real quick and make sure it all feels good. And good. Excellent. Can you look all the way over your left shoulder for me?
He already knew.
Yeah, he did. He's already got it down. Well, good job, Xander. You did great. Yeah, good high five.
So that's as simple as an adjustment for a kid.
That's it, actually. As simple as that. It's nothing extreme or anything. It's extremely gentle and easy to go.
Well, thank you, Dr. Matt, for your time.
No problem.
Enliven offers many different services, and every week we'll check back in with one of the doctors to learn about another one of the unique treatments they offer.